vibration, percussion, and postural drainage. So if you look at the white packet, it describes what vibration would be. So watch this, because this is what vibration is on a real person. I would take my hands and I would never lift them off of the patient. Notice my hands did not come off the table. I just kept vibrating. And your table's vibrating. That's what we want the patient to do. Your percussion, on the other hand, again, you don't have a vest on this test, is done like this. Cupped hands. That is your percussion. Okay? So you guys got to know that. And that's your chest physiotherapy. Okay? Now, MDI. If you turn the page, you have your little MDI. You've got your little peak flow. It's nice here for you. One of the things I want you to remember with this metered dose inhaler is if you take your highlighter, you see on the second paragraph, it says there are 2 methods for using an MDI. And one of them is a valved holding chamber. Highlight that. That's called a spacer. Make sure you write spacer. Make sure you know shake it first. Write that real big. Shake first. So that's a big deal. So you just write it, even though it's there already. Just write it again. Make sure you shake it first. So if you look at the numbers, you've got these different numbers. Shake well. You see that's first. But then you need to put something after that. You need to tilt the head back and exhale slowly. Before you put it in your mouth, tilt your head back and exhale slowly. So if I'm getting ready to try this is me pretending. Let me do it with this. This is my canister, okay? Got it? Tilt my head back, breathe out. I'm trying to clear everything so I can take a real big, deep breath. Okay, that's the key, right? Okay, so you tilt the head back and just exhaled. And now we're going to get this party started. So number 3 and number 2. 2 different things I want you to know about this inhaler. For steroid inhaler, we do not put it in our mouth. We do not put it in our mouth. For steroid inhaler, we put it 1.5 inches in front of our mouth. For a bronchodilator, we put it in our mouth. And it's clenched with your teeth in your mouth. Okay, now number 4, where it says breathe out completely, is out of order. That's where you should have tilted your head back and breathe out completely. Take an arrow and put that above number 2. Just show number 4 is actually really number 2. Because they changed a little bit here. Now, everything else is fine. Breathing in slowly, holding your breath for 10 seconds, repeating it, and doing your second puff. All of that's the same. And I would highlight those little things. I would put, breathe in slowly, hold the breath for 10 seconds, repeat it, blah, 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 blah. Okay? Now, you do need to shake it well. You see, that's true for all of it, okay? All right, now, other than that, you don't need to go crazy here. However, if you go to the next page, and we're talking the asthmatic, not the COPD patient. Go down where it says checking your MDI, second paragraph, last sentence. It says at 120 puffs, the MDI should last how long? 30 days if used, I want you to write this, if used daily. Or, here's the part you want to write, and this is most important, 3 to 6 months for rescue. Or 3 to 6 months for rescue. So here's what you're going to notice. The 30 days, that's COPD. The rescue, that's asthma. So the part where the MDI may last 30 days, that's COPD, because a lot of times you do things BID. Do it twice a day. If it's asthma and you just need your bronchodilator as a rescue, it should be around 3 to 6 months. Okay. Okay. Peak flow meter. Next page. For the peak flow meter, you're going to take your highlighter and you're going to highlight where it says peak expiratory flow, or PEF, because that's the other name for it. You may not know what it is if you don't know that other name. Peak expiratory flow, or PEFs. The doctor wants to know what's his PEFs. Now, the next sentence is the most critical because you still have idiots out here not giving their patients peak flow meters. It says a person's PEF might drop hours or even what? Days before asthma occurs. So this is, please write it, a predictor. The peak flow meter is a predictor. This is going to help you not miss work if you got a kid with asthma. It's going to help your kid not miss school if they have asthma. Yet, 69% of all kids and adults have no peak flow meter. That's criminal. Now, mind you, when you leave my class, you go your little happy ass right to your doctor's and you get one. And then your whole life changes and you can't believe how much it changes. You let me know that you haven't missed work ever since my lecture, because the damn thing predicts when your kid's going to have an asthma attack. And I don't want to get that call when I'm in class. I don't want to get that call at clinicals. I don't want to get that call when I'm scrubbed in the OR and the secretary tells a nurse to go and get me out of scrub because my kid needs me at school to go to the hospital because they just had an asthma attack. You would have knew that shit that morning. This is ridiculous how many doctors don't give this. And this kid, 4 years old. You better know your pediatrics. 4 years old can use this. So 4-year-olds and up can use a peak flow meter. My damn grandson, 3 years old, gives himself treatments every day. So I know damn well he can use a peak flow meter. Okay, so you gotta know, this is so serious. You don't need to be missing work like this. Now, when you do a peak flow meter, remember what we say. We blow in the peak flow and we suck the balls in incentive spirometry. You can't mix them up. Blow in the peak flow, suck the ball in the incentive spirometry. You blow the balls in the peak flow, you're sucking balls in incentive spirometry. Y'all got stuff to do. And if you tell this 96-year-old lady that she's sucking balls, I will hurt you. Or a 4-year-old kid that he's blowing balls, you don't get it. But you're going to remember it that way for school, for your test. Okay? Now, look what it says. 1, 2, 3, 4, 5, 6, 7, 8, huh? Stand up straight. Oh, yeah. You better know that. Make sure the gauge is at the bottom. Take a big, deep breath, put it around the peak flow, and what does number 5 say? Exhale? Or does it say something different? Oh, okay. Blast the air out as hard and as fast as possible in a single blow. Record the number, repeat this 3 times, and which one do we use? The highest reading. And you keep a diary. You'll automatically see how amazing this is for your kid if you get one of these. You got it for your baby yet, Alicia? Who did you say? Who was you saying? Was it you or somebody? Was it Amira? Oh, I know it was somebody that used this and did very much better. People love this once they get it because it really helps them figure out when they're going to have an asthma attack. Now, when you first get diagnosed for asthma, you do this 2, 3 times a day because it's pretty bad. We don't have you under control yet. We don't know when you're going to. I don't know who was here when the girl never came back from the break in this class. What happened to her? She was having an asthma attack and driving. Got pulled over by the cop and sent to the ER. She never came back from break. We tracked her down, and that's what happened to her. That morning, she could have done her peak flow and known that. This is a predictor. Trust and believe she never did that again. She now has a peak flow meter. She now does it every fucking morning. She now knows if she's going to have an asthma attack. And because of it, she prepares by using her inhaler. So remember how this goes. For kids, it's kind of cool. It's kind of simpler for kids than it is adult. But you're still going to know both. This isn't quite yellow, but we're going to pretend. The peak flow meter works off of 3 different colors for kids. What does a red light mean? It's just like a traffic light. Stop. Red light means stop. So a red zone for the peak flow means stop. What does a green light mean to you and me? Go. What? Green? The hell? Okay, baby, we're going to pray about it. If you yielding at the green light, we got to pray. Okay, so at the green light, you're supposed to go, right? Now, your child did a peak flow meter that morning. They good to go. Remember that. If it's green, they good to go. Yellow means caution. It means, you didn't really do that great, but you didn't do bad enough to make us worry. But you did bad enough to make me think and wonder if your medicine is going to work as well as it should. So what am I saying? Quote me on this one. Yellow zone means the maintenance drug is not working as well as it should. Yellow zone means the maintenance drug is not working as well as it should. So we called the doctor's office with that one and let them know, my child blew a yellow zone. We don't call 911. We don't call and, we talk to a nurse, right? We don't need to talk to a doctor about this. We can talk to a nurse about it. And it also gives you a little heads up, because what if it's like green zone yesterday, yellow zone today, you left a message with the office, yellow zone tomorrow. You see it's getting worse, right? I mean, it's staying bad. Okay, so just think of it like that. Now, you got to put these very, very precise guidelines for red zone. Okay, red zone, stop. Grab your rescue inhaler, so bronchodilator. Get the bronchodilator. Use it. Wait 30 minutes. Don't forget that part. That's a part a lot of parents forget. Wait 30 minutes. Don't be calling 911. Wait 30 minutes. And then blow in the peak flow again. If it's still a red zone, then you need to go to the hospital. Either 911 or whatever. Because 30 minutes later, your little bronchodilator didn't work. Okay? Okay, beautiful babies.